Honorable Minister Horowitz, and my brother Hans Kluge, Excellencies Ministers, Excellencies Heads of Delegation, dear colleagues and friends. Good morning. Shalom. Let me start by thanking His Excellency President Herzog, who was with us earlier today, and Minister Horowitz and the government of Israel for their hospitality in hosting this year's Regional Committee meeting. The fact that we're once again able to meet in person is testament to your success in bringing the COVID-19 pandemic under control. Here in Israel, you have done what WHO called for from the beginning in taking a comprehensive approach to reduce transmission and save lives. We also thank you for your scientific collaboration in sharing your experiences in dealing with different variants as they have emerged. It's very pleasing to see that here in Israel and across the region, the number of weekly reported deaths is near its lowest since the pandemic began. This is a good news. Many European member states, including Israel, are among those with the highest vaccination rates in the world. It's especially pleasing to see that many member states have focused on vaccinating the most at-risk groups. However, I continue to urge caution. 1/3 of the region's population remains unvaccinated, including 25% of health workers and 20% of older people. These vaccination gaps pose a risk to us all. A precipitous drop in testing and sequencing is blinding us to how the virus is changing. And with colder weather approaching in the northern hemisphere, it's reasonable to expect an increase in transmission and death. So I urge all member states to focus on vaccinating all health workers and older people as you continue to pursue the target of overall average of 70%. I also plead with you to increase testing and sequencing, because when it comes to the virus evolution, ignorance is not bliss. In the coming week, WHO will publish a set of 6 short policy briefs outlining the essential actions that all governments can take to reduce transmission and save lives. The briefs cover the essential elements of testing, clinical management, vaccination, infection prevention and control, risk communication and community engagement, and managing the infodemic. I hope you will use these briefs to reassess and readjust your policies to protect those most at risk, treat those who need it, and save lives. The pandemic is always evolving, and so must the response in every country. Meanwhile, just as we are beginning to hope of an end to the pandemic, another new virus has reared its head in the region, monkeypox. Although mortality is thankfully very low, we know that this disease can cause severe pain requiring hospitalization. Although this region continued for the majority of cases, this region accounted for the majority of cases at the beginning of the outbreak, it's very pleasing to see a sustained decline in most European member states. But as with COVID-19, a downward trend can be the most dangerous time. if it opens the door to complacency. We continue to recommend that all member states persist with the measures that have worked so far. Tailored public health interventions, testing, deep community engagement, and targeted vaccination where vaccines are available. The effectiveness of these measures so far confirm what we have said consistently since the beginning, that with the right approach, this is an outbreak that can be stopped. And in regions like this one, which does not have animal to human transmission, this is a virus that can be eliminated. We might be living with COVID-19 for the foreseeable future, but we don't have to live with monkeypox. COVID-19 and monkeypox are both threats that have arisen from our relationship with nature. This year, another threat has cast a shadow over the region, which is entirely of human origin, the pole of war. The Russian Federation's invasion of Ukraine is having a devastating impact on the physical and mental health of Ukraine's people, with consequences that will reverberate for many years to come. We're now seeing an increase in cases of COVID-19 in Ukraine. We project that transmission could peak in early October, and hospitals could approach their capacity threshold. Oxygen shortages are predicted because major supply sources are in occupied parts of the country. We're also deeply concerned about the potential for the international spread of polio due to the gaps in immunization coverage and mass population movement linked to the war. WHO continues to support the Ministry of Health of Ukraine to restore disrupted services, displaced health workers, and destroyed infrastructure, which is essential not only for the health of Ukraine's people, but for the country's resilience and recovery. So far, WHO has helped to deliver more than 1,300 metric tons of critical medical supplies, with more on the way. And I had the opportunity to visit and to see the needs firsthand last May. The support we provided include power generators, ambulances, and oxygen supplies for medical facilities, supplies for trauma and emergency surgeries, and medicines to help treat non-communicable diseases. We have also helped to train more than 9,000 health workers on trauma surgery, mass casualties, chemical exposure, epidemiology, and laboratory diagnostics. And we're providing stress management training for health workers and the wider population. However, attacks on health continue unabated. In the past 6 months, WHO has verified 516 attacks on health, with at least 100 deaths and 129 injuries. No health system can deliver optimum health to its people under the stress of war. The only solution is peace, which is why we continue to call on the Russian Federation to end this war. Excellencies, dear colleagues and friends, your agenda this week reflects the unique and complex range of challenges you face as a region and as individual member states. Your agenda also reflects the 5 priorities I outlined in my address to the World Health Assembly 3 months ago. Promoting health, providing health, protecting health, powering health, and performing and partnering for health. Allow me to discuss each one briefly. First, promoting health. Realizing our vision for the highest attainable standard of health starts not in the clinic or the hospital, but in schools, streets, supermarkets, households, and cities, especially in our homes. That's where promoting health starts. Much of the work that you do as ministries of health is dealing with consequences of poor diets, polluted environments, unsafe roads and workplaces, inadequate health literacy, and the aggressive marketing of products that harm health. That's why we're calling on all member states to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing its root cause and creating the conditions for health to thrive. The framework for action on alcohol that you will consider this week is essential for addressing one of the major risk factors in this region, which has the world's highest consumption of alcohol. And I was very glad to hear from Vesna, our executive board chair, the progress which is happening, and I hope you will agree on this week. I'm also very pleased to see that you will consider a regional action framework for behavioral and cultural insights for health, which is an emerging area of work for WHO. Understanding why people make decisions that affect their health is essential for designing the right policies, programs, and interventions. The second priority is providing health by reorienting health systems towards primary health care at the foundation of universal health coverage. We know that 90% of essential services can be delivered at the primary health care level. This region is home to some of the most advanced health systems in the world, with high levels of service coverage and financial protection. However, even in these member states, aging populations, the increasing burden of NCDs and mental health and financial pressures are putting increasing strain on health systems. In other member states, there remains much work to be done to expand service coverage and financial protection, especially for the most marginalized and hardest to reach groups. After all, it's not universal health coverage if it's not universal. So I'm very pleased that this week you will consider a framework for action to achieve the highest attainable standard of health for persons with disabilities. Several other agenda items are important initiatives to push back diseases, including HIV, viral hepatitis, sexually transmitted infections, cervical cancer, and tuberculosis. Your secretariat will continue to support you, and in our country and regional offices and at the headquarters to meet these challenges, especially by strengthening primary health care. Primary health care in all income levels. The third priority is protecting health. By strengthening the global architecture for health emergency preparedness, response, and resilience. The COVID-19 pandemic has exposed significant vulnerabilities in the world's defenses against epidemics and pandemics. And the global monkeypox outbreak is yet more evidence that the world's collective failure to address neglected diseases in neglected communities puts us all at risk. In May, the Secretariat published a white paper with 10 key proposals for stronger governance, stronger financing, and stronger systems and tools for global health security under the umbrella of a new, legally binding international accord, which member states are now negotiating. I thank those European member states who have been instrumental in this process. several of the 10 proposals are already being acted on, including a new financial intermediary fund for pandemic prevention, preparedness, and response, which was just established last week at the World Bank. I thank Italy, Germany, the United Kingdom, and the European Union for your generous pledges as founding donors. In May of this year, Portugal became the first member state in the regions to pilot the Universal Health and Preparedness Review, and I very much appreciate the active support from European countries for this mechanism, including France, Luxembourg, Switzerland, and the United Kingdom. I also thank Hans, my brother, and the regional office for supporting member states to strengthen their capacity to prevent, prepare for, and respond to health emergencies. The fourth priority is powering health by harnessing science, research, innovation, data, and digital technologies. Advances in science and research are constantly pushing back the boundaries of the unknown and the impossible, increasing our understanding and opening new possibilities. Innovation in health products and service delivery give us hope of overcoming challenges that once seemed insurmountable. Developments in big data and machine learning are helping us to see who is being left behind, where the biggest gaps are, and to track progress against our targets. And digital technologies offer huge potential for delivering health services in new ways to more people, especially in hard-to-reach areas. To pick up the pace towards the triple billion targets and the SDGs, we must pick up the pace and scale at which science, research, innovations, and digital technologies are adapted and implemented. The Regional Digital Health Action Plan you will consider this week will be important for accelerating the use and impact of these tools across the region. Finally, the fifth priority is performing and partnering for health by building a stronger WHO that delivers results and is reinforced to play its leading role. The pandemic has demonstrated not only why the world needs WHO, but why the world needs a stronger, empowered, and sustainably financed WHO. I thank all member states for the historic commitment you made at this year's World Health Assembly to gradually increase access contribution to 50% of the base budget over the next decade. This commitment will transform the Secretariat's ability to deliver results where it matters most, in the lives of the people we all serve. Maintaining momentum is vital. The first step toward sustainability comes with a proposed 20% increase on access contribution in the 2024-25 budget. As you know, even before the pandemic, we had already made major improvements in effectiveness and efficiency through the transformation journey that we have done over the past 5 years. Building on the lessons of the pandemic, we are committed to continuing that journey and to making WHO even more effective and efficient. In particular, our focus in the coming years is to significantly strengthen our country offices, to support greater country capacity and greater country ownership, especially by strengthening the health workforce of every member state. And we have, as part of our transformation, the WHO Academy, which is now being positioned to help countries build their capacity. I welcome the strategy for collaboration between the regional office and member states that you're considering this week, which I trust will help to identify areas where we can support you to implement the policies and programs that will make the biggest difference in the lives of the people we serve. Excellencies, Just over 3 weeks ago, I began my second term as Director General. I thank all member states of the European region for your support for my re-election at this year's World Health Assembly. The support was overwhelming, and my appreciation and respect to all European countries. Thank you for your confidence and trust. I think what happened was the first in history. You did everything and went extra mile to support me. So I don't think only saying thank you will express all that I really feel. So thank you so much. Very, very grateful, and look forward to work with you very, very closely. In the past 5 years, I have had the honor of meeting many of the people we serve in this region and around the world. Ultimately, our work is not about roadmaps, action plans, strategies, and agenda items, as important as those things are. Our work is about people, and particularly the people who are poorest, the people who are most marginalized, and the people who are furthest behind. That's why we are here. And that's why I look forward to working with you for the next 5 years as we work together to promote, provide, protect, power, perform, and partner for health. I thank you so much. Toda roba. Thank you. Thank you.